Also, we see changes here in this meniscal type of tissue here. Now, this treatment was done on spinal nerves of L2, 3, 4, because that's what goes to the knee. Here's the same patient, just a lateral view, before and after. All right, effects of Ichi on blood. This is a study that I did because I had been watching Dr. Bob Beck for years. I couldn't get enough of his seminars, which were on YouTube, and I was treating using his stuff, which Blood Electric comes from. And he said it did a lot of good things, but I wanted to see if it was real so I wouldn't be wasting my time for the rest of my life if I keep doing it, right? So I took 4 patients, tested them before and after giving them Blood Electric for 1 week daily. Every time you see a slide where it's the upper left, that's the untreated blood. Upper right is after 1 20-minute session. Lower left is after 1 week. And then lower right, we stopped treatment after 1 week, and I retested them at the 2-week mark. This worked and blew me away. It works so much better than what Bob Beck said it did. He said it cleans up the aliens in the blood, meaning pathogens. But here's what happens to the white blood cells. This is a single neutrophil. It's atrophied, it's symmetrical, it's not active. And this is video. Well, this isn't video, but you can watch this like a video. So you can see, you can watch this white blood cell in a single drop of live blood, and you can see if it's active or not active. And this was not active, same size as a red blood cell, which you see next to it, and it's supposed to be bigger. Look what happens after 1 week of treatment. These are also neutrophils. They are not symmetrical, they're much larger than a red blood cell, and they're releasing this phagolysosome here. You can watch this bugger clean up pathogens from the blood. It takes about 5 to 6 minutes for it to release its lasso and suck into its body bad stuff, bad terrain, pathogens. So, and the neutrophils are one of those main white blood cells that is just so prevalent and needs to clean up the terrain of the blood. How important is the immune system for any disease? Super important, right? Now, this is after 1 week treatment. Then we stopped treatment and then rechecked a week out because I wanted to try and see how long the treatment lasts. Well, I should have checked 4 months out because what I found was that it's real fast adding the electricity, but it's slow for the immune system to actually do the chemical work of cleaning up the terrain. It actually has to work real hard, and once it has the energy, clean up the terrain so that, you know, realistic expectations for what your patient, like, yeah, you gave them a Blood Electric, realistic to think that they're walking out of your office after 20 minutes with decreased heart attack risk, decreased blood viscosity, easier, you know, much better heart health. But it's unrealistic to think that their terrain is cleaned up after 1 treatment. It takes time. It takes time. It takes time with skeptical acupuncturists too. We have acupuncturists, maybe they saw my webinar like 5 years ago and they didn't take my webinar because they thought I was hokey pokey salesman, right? But 5 years later, they come back and patients come back too. You may treat a patient today and they're like, I'm not gonna come back, I don't think it's working. And then 3 years they come back to you and say, this is the only thing that worked, because they needed that time for the terrain to be cleaned up. They needed the time for the body to make changes to itself. Now, you're going to see treatment. Every time you treat, you should see some change. What is that change? It's switching sympathetic into parasympathetic. So a person can only detox when they have a strong parasympathetic tone. So that, what are the symptoms of a virus, which doesn't exist, by the way? And virus in Latin means toxin. Fragments of toxins. What are the symptoms of a virus? Fever, sweating, diarrhea, vomiting, expelling toxins, right? So what are the symptoms of detox if you do my treatment right to somebody who hasn't been able to detox in 50 years? All the same symptoms. They get headaches. They get loose stool for a couple days. That's normal. And you have to inform your patient, we're getting somewhere. Give me $500 because I caused diarrhea. I did something. I moved them in the right direction. That's the results you should get after 20 minutes. The results we're looking for. The patient wants to get better, but they need time to get better once you charge up their neural levels, for example. Now, oxygen potential, because red blood cells carry oxygen, and they also carry negative charge. So one cool thing about the blood electric is if I have a red blood cell, his name's Bob, and he travels through my radial artery. All the blood in the whole body goes past here in about 10 minutes. So Bob comes here, picks up a negative charge from my blood electric treatment, and then continues to circulate around and offloads its negative charge or healing energy to whatever, maybe the liver's deficient. It'll offload that Ichi to the liver, and then Bob, the red blood cell, will come back and circle around here and get charged up again. It's really cool. But it also carries oxygen. Upper left is the same light setting as the lower right, and the amount of light passing through from the bottom to the top gives you a general idea of how much oxygenation potential these red blood cells have. So you can clearly see in all cases, well, I only did 4 patients because I wasn't funded, but you improve oxygenation. Here's just another patient, and you're looking at white blood cell improvement. Now, all of the patients that I took through my study, they were considered healthy by Western medicine. But look at this worm-like parasite in a quote-unquote healthy person. All of them had parasites. What is a parasite? It's a misguided somatid. It's us in a bad terrain, evolving into what appears to be an alien, but it's not. But it's still reversible once you clean up. Now I'm getting off on a tangent here, but this thing's alive. You can zoom in on it, you can watch it eat things, and you can watch it travel down its stomach. And then here, 2 weeks later, this thing's dead, and you see a different type of white blood cell than a neutrophil dismantling it. But it takes time to dismantle this huge, dead, worm-like structure. And then this is clearly easy to see. This patient, the doctor would say, "You're healthy." Well, I know there's not enough negative charge here because cardiologists call it zeta potential. It's the amount of negative charge on the outside of red blood cells. Negative repels negative. These red blood cells need to pass through a capillary single file, and they need to squash down to about a half or 40% of their original height to go through a capillary, offload its oxygen and carbon dioxide and Ichi, basically. 20 minutes later, look at the, now we zoomed out here, but look at the free-floating red blood cells.